Hi, I'm Dr. Christopher Bunick, Associate Professor of Dermatology at Yale University School of Medicine, and I'm here to talk about the clinical trial results from Level Up. I was an investigator in Level Up, and this particular trial really looked at the efficacy as well as safety of upadacitinib head-to-head with dupilumab in both adults and adolescents that had moderate to severe atopic dermatitis. But there are some unique features about this trial that are really relevant to the cutting edge standard of care of atopic dermatitis. And we're going to talk about that. This was an open label, but efficacy assessor blinded head-to-head trial. I think that one of the big concepts to understand behind Level Up is that a lot of atopic dermatitis patients, particularly those moderate to severe atopic dermatitis patients that are on systemic therapy, are not necessarily always well controlled, or they may experience flares or significant clinical burden, so that other therapies are needed besides standard biologic therapies. You might need the oral JAK inhibitors. And so this trial was really trying to understand, in the big scheme of all the systemic therapies we have for moderate to severe atopic dermatitis, how are they head-to-head when used on label? And I'll explain more about what I mean by that. But what really the take-home point of all of Level Up is that it used the most stringent target endpoint ever in terms of efficacy. Because it wasn't just asking, could a therapy, either upadacitinib or dupilumab, hit EASI 90, the skin relief, and it wasn't just asking, could it hit the itch relief? It was saying, we want to know which therapy can treat both the skin and the itch. So this is what is called a composite endpoint, hitting EASI 90 and itch numerical rating scale score of 0 or 1, basically meaning no or almost no itch. And the reason this is so important is that we know that the quality of life of atopic dermatitis patients is significantly worsened just by going from an itch score of 1 to a 2. That's new data from the Target Derm Registry. So we know that this is so important. And this trial looked at that composite endpoint of EASI 90 and itch 0 or 1. So how was Level Up designed? I'm just going to briefly talk about the design. There are really two periods to this trial. The first period was the open label efficacy assessor blinded treatment period for up to week 16. And these particular patients were either randomized 1-to-1 to upadacitinib 15 milligrams daily or dupilumab per label. And throughout those 16 weeks, starting at week 4, if patients didn't meet a certain EASI response, they were able to be increased from the upadacitinib 15 milligrams up to the 30 milligrams, which is an on-label use in the United States. In other areas of the world, you may be able to start with upadacitinib 30 milligram dose, but here in the United States, you have to start with the 15. So this is really looking at the real world use of upadacitinib on label in the United States, starting at 15 milligrams daily, and then at week 4, the ability to dose escalate to 30 milligrams. At week 16, so the data that we're going to talk about is the week 16 period 1 data. Period 2 is the extension period for an additional 16 weeks out to week 32, where patients that did not achieve EASI 75 on dupilumab were switched over to upadacitinib, and those at week 16 that were less than EASI 75 on the 15 milligram upadacitinib were increased in dose to the 30 milligrams. And then that gets you to period 2 out to 32 weeks. And that data will be forthcoming in months. I just wanted to mention from a demographic standpoint, just few key highlights about the demographics of the patients that were in. The total number of patients was around 920, with 117 of those being adolescents. And about half, about 458, got upadacitinib, 462 got dupilumab to start. About 42 to 47% were female. And I think that when it comes down to the key AD criteria, in general, about 38% of the body surface area was involved with atopic dermatitis. That was the mean. When you talk about the baseline IGA scores, about 58% were moderate, and then the rest were severe. And the mean EASI score is around 27 to 28, and the mean itch score at baseline was around 7.5 to 7.6. So that gives you a little bit of a background of where these patients were starting. So what are the key primary endpoint? So again, I told you that this trial the cutting edge standard of care component to this trial is the composite primary endpoint at week 16 of EASI 90 and itch NRS of 0 or 1. And what the primary results showed was that the upadacitinib treated patients, about 19.9, or we'll round that up to 20% of the patients, achieve this composite primary endpoint. This is 1 in 5 patients meeting the most stringent criteria ever assessed in an atopic dermatitis clinical trial. Dupilumab was less than half that, at around 8.9. We'll round that up to 9%. So you're looking at 20 to 9. Upadacitinib more than doubled the performance of dupilumab in meeting this primary endpoint of the EASI 90 and itch NRS of 0.1. What does this mean clinically for your patients? I think most importantly, the thing to take home is that when you have a patient who has clear skin but is still itchy, their treatment's not good enough. If you have someone who has no itch but their skin isn't clear, the treatment's not good enough. What we know now is that in order to really elevate the standard of care of treatment of atopic dermatitis in dermatology, you have to have both the skin clear and the itch minimized or clear. And this composite endpoint shows us for the first time that the oral JAK inhibitor upadacitinib is superior to dupilumab in meeting this endpoint. I'm not going to go through all the secondary endpoints. There's a number of other secondary endpoints, such as like looking at EASI 90 by itself or itch by itself, and then looking at the early time points. I think the key take-home message from the secondary endpoints is, again, that upadacitinib beat head-to-head dupilumab in all the secondary endpoints. And I think the key component of the looking at the week 2, week 4 breakdown of some of these itch and EASI scores is that upadacitinib works quickly, more rapidly than dupilumab in reducing the skin flares and the itch. And that's the take-home point with the results there. When we think about using oral JAK inhibitors, we always think about safety. I know that can be concern among some providers about safety, but what we're learning with the long-term safety data of oral JAK inhibitors is that they're proven to be safer and safer than we could have ever imagined. And in Level Up, that safety came through in the same manner. It was highly, highly safe, the upadacitinib, as was the dupilumab. So what we know is that the total number of adverse events seen was roughly equal, slightly higher than the upadacitinib, but when you looked at serious adverse events, it was equal 4 events, both upadacitinib and dupilumab. But key, it was very similar. Very few events led to discontinuation of the study treatment, and more importantly, there were no deaths. And when you break down these adverse events of special interest, the ones that people worry about, neither in the upadacitinib or the dupilumab arm of the Level Up trial, there were no events of MACE, there were no events of VTE, there were no events of cancer, and there were no gastrointestinal perforations. So all of these main things that people get concerned of, 0, 0, 0. This is reassuring safety from Level Up that upadacitinib and dupilumab have equal high safety. Now, the one thing that we do know about the oral JAK inhibitors is some risk for herpes zoster or eczema herpeticum. In terms of opportunistic infections, they were very low. Just about 1% may have experienced that in the upadacitinib. 5 cases of eczema herpeticum, which can be treated. So just point that out. But overall, very, very reassuring safety profile. So the ultimate conclusions from the Level Up trial are that treatment of moderate to severe AD with upadacitinib initiated at 15 milligrams and then dose escalated up to 30 milligrams based on that clinical response, right, starting at week 4 and then reevaluated at week 8. This demonstrated superiority head-to-head with dupilumab, using dupilumab on label for the most stringent primary endpoint ever analyzed in dermatology for atopic dermatitis in a clinical trial, combined EASI 90 and itch NRS of 0.1 at week 16. Again, the take-home clinical pearl is you need to be evaluating your moderate to severe atopic dermatitis patients, both adolescents and adults, understanding their level of skin clearance and itch. And if it's not satisfactory on a systemic therapy, biologic therapy, then you really should be thinking about the oral systemic JAK inhibitors. In this case, we're showing upadacitinib beats Dupi head-to-head. I had mentioned about some of the secondary endpoints, but we know that upadacitinib, the superiority over Dupi, was demonstrated as early as week 1 for itch and as early as week 2 for skin clearance. I mentioned no new safety signals that came up in this trial, at least through the 16-week period. Obviously, the data for the 32-week period is not out yet, but certainly excited to see what that shows. Lastly, I'll leave you with this point, and that is that the achievement of stringent itch and skin targets. The idea is that it can optimize the overall disease control for patients that have moderate to severe atopic dermatitis. This is the whole reason we're trying to elevate the standard of care. Better regimens, better medicines, better treatment and quality of life for atopic dermatitis patients. And what the Level Up trial has shown is that we need to be using composite endpoints, composite measures of both skin clearance and itch relief in order to get our patients to that next level, our atopic dermatitis patients to that next level. In this particular 16 weeks, upadacitinib certainly looked very promising as that therapy.